Lots of good questions for office hours that we are going to address today. Thank you so much for watching. I'm Dr. Meghan. I'm a board certified physician in internal medicine, lifestyle medicine, and obesity medicine. If you are confused about your weight, if you have questions about weight medicine, and if you want medically based answers to your weight questions, you are in the right place. Welcome to Office Hours. Thank you so much for your lovely messages about my COVID adventure last week. That was not fun, but we are on the other side and all systems go. So we're going to get right back into the questions today. Thank you so much for asking them. If you have a question afterwards, please feel free to leave it on the comment section of this video or on another video. If you have questions pertaining to that, I will definitely find it and I will add it to the list. So thank you so much for your questions. As a side note, if you want to work with me directly, you can. I have a few spots left for consults in September. I will leave the consult link down below. The goal of the consults is that we are identifying your roadblocks and your blind spots with regards to weight issues for you. So it's supposed to be very targeted and effective in terms of what we were going over for that time. It is not a high pressure like sales situation. It's low key and it's fun. And the goal is that it's very helpful for you. So if you want to chat with me over a consult, I will leave that link down below. And let's get started on the questions today. All right. So I can't answer personal medical questions. So I will tweak the questions just a little if it's leaning a little too personal because I'm not your personal doctor, so I can't answer personal medical questions. But so I might change it a little bit to make it more broadly applicable for everybody for educational purposes. And let's get started. So first question is about Topiramate. The question is this also, can this also be prescribed as a sleeping pill? It looks like somebody was maybe prescribed this for weight, but also potentially for sleep. And the answer is yes, that would be an off-label use for Topiramate. Topiramate has many. It's an anti-seizure medication, but we use it for actually a lot of other things as well. Migraines, tremors, medication-induced weight gain, binge eating. Like there's many different uses for this medication. I made a whole video about it, so I'll leave that linked below. But I wouldn't say it's like a go-to for insomnia, but certainly if somebody had one of those medical issues and they had issues sleeping, it would certainly be a viable alternative in terms of sleep medication, because part of the side effect profile of Topiramate is that it can make people sort of drowsy or sleepy. So that would be kind of a side effect that might work in somebody's favor. So definitely something that might be kind of a 2-for-1 situation. Great question. Okay. This is a question about dose conversions. Somebody is wondering if it's normal to go from Ozempic 14 milligrams for weight, then go to Rybelsus 14 milligrams the next week, and if that's normal. I am wondering if no, because I'm not quite sure what you're referring to as the dose of Ozempic, because Ozempic only goes up to 2.0 milligrams per week. So Wegovy can go up to 2.4 milligrams a week, but there's no dosing of 14 milligrams for Ozempic. So that is just not, that is like a lot, and it's not what you would generally be dosed for weight or diabetes. So I'm thinking either this is a typo or maybe somebody's using like a compounded version, in which case, like you guys know how I feel about compounded versions. I don't think they're safe. I don't think they're a good idea, precisely for kind of these reasons, as people don't know how much they should be taking. There's been issues with people overdosing. There's a lot of problems with them. So I won't go into all of that here, but just as a PSA, the highest dose of Ozempic is 2.0 milligrams per week. certainly, depending on what's going on with somebody, their doctor might transition them over to Rybelsus, which is an oral form of semaglutide. However, Rybelsus is only FDA approved for diabetes, and at the current available doses, and again, I also made a whole video about Rybelsus, so you can check that out too if you want. At the current available doses, it's not really great for weight loss. It is currently being studied in terms of what doses might be helpful for weight loss, but it's definitely not something that I would really ever approve for somebody, would really ever prescribe for them for weight loss, because it just doesn't work very well for that, and it can have a lot of side effects. So it's kind of like a lose-lose situation for that issue. Now, somebody might be prescribed Rybelsus for diabetes, in which case 14 milligrams is on the higher end of that dosing spectrum. So it's very possible for somebody to go from Ozempic to Rybelsus for a variety of reasons, but definitely wouldn't go from 14 milligrams Ozempic to 14 milligrams of Rybelsus. So that's not normal, but changing for a variety of reasons from the injectable version to the oral medication, that's very possible, just not at that dose level. And there's a lot of reasons why somebody might want to be on Rybelsus for diabetes. One of the major ones being they don't like injecting themselves once a week. So that's the story on that. That's a great question. Okay, this one I am going to shorten a little and kind of condense it and make it not personal. So the gist of this question is a side effect of Mounjaro skin thinning and bruising? That is not something that I see as a common complaint at all. So definitely something you want to talk. If you have been on Mounjaro or Zepbound and you're like, hey, I'm bruising a lot more than normal, or my skin feels thinner and I'm getting skin tears more often, that's definitely not something that I have seen. Now, there are millions of people on these medications. So some people are going to have side effects that are very uncommon, but that's definitely not something that I have seen. And those types of, I will say as a caveat that if you lose a lot of weight on these medications, you have less fat as a kind of healthy barrier in the subcutaneous layer in general. So, and particularly as people get older, their skin does become thinner and more prone to tearing. So both of those combined, it's possible that just kind of fat loss in general, weight loss in general, can predispose somebody's skin to maybe being a little bit more delicate and fragile in a way that it wasn't before, because they had more of that subcutaneous fatty tissue as a cushion. However, that's just with regards to the mechanics of weight loss, and not particularly as related to tirzepatide in general. So if that happened to my patient and they said they had more skin tears and bruising, I'm going to be thinking about other causes, because sometimes that can be a bleeding issue, like a bleeding blood, like coagulation issue, lots of different things that can cause that are not related to this medication. So if I had a patient like that, I would definitely be looking at other causes, and my go-to would not be to think about the Mounjaro or the Zepbound itself as the primary cause of that issue. So, great question. Can you take Topamax and Zepbound together? Yes, you can. Doesn't matter what order you start them in, but they, the Topiramate works in a completely different mechanism, and than the Zepbound. And the Topiramate is an oral medication. The Zepbound is an injectable. So certainly, it's very plausible that somebody could be on tirzepatide find their new normal for that medication. And then if they and their physician feel like they're not quite at the BMI that's healthiest for them, they might elect to add something like Topiramate to help with some additional weight loss. And it's going to have some other helpful side effects, like if part of the weight loss issue has to do with binge eating, the Topiramate could be very helpful. Or maybe, they also have issues with other medical, if they also have other medical issues, that the Topiramate would be kind of a good 2-for-1, like they have migraines and they still want to try to get their BMI lower. There's many reasons why you might combine those medications, but overall the answer is, in theory, yes, you could certainly prescribe, somebody could certainly be on both of those medications for weight loss if it's the right person. So that's going to do it for today. Thank you so much for all your questions. I'll leave the links to the videos below. I'll leave the sign up to the consult below. And if you have any questions about weight loss medications in general, definitely leave in the comment section. Like, subscribe, do all the things, and please be well.